The month of January doesn't just kick off the new year, it's also a time to emphasize the importance of body awareness. As it's Cervical Cancer Awareness Month, Dr. Michelle Rowland, a gynecological oncologist with OSF HealthCare, joins us now with more. Good morning. How are you, Michelle?
Good morning. Thanks for having me.
Thank you for coming here and talking to us about this. It's very important. First, I would like to know, can you tell us what are the symptoms that women should be looking out for when it comes to cervical cancer?
Yeah, so the most common is that people actually don't have any symptoms, and that's why we encourage regular screening. However, if someone has new irregular bleeding or new discharge or new pelvic pain, those would definitely be reasons to talk to your healthcare provider.
Okay, yeah, and that's scary. So there's no symptoms.
Yeah, oftentimes no symptoms. So we want to make sure we're regularly checking in to make sure you're getting the right screenings.
Okay, that's interesting. And so, we are in a new year, people are creating new habits. What is something that women should be striving to look out for to prevent cervical cancer?
Yeah, there's three main things I would recommend for prevention. Regular screening with pap smears, so make sure you're seeing your provider for those. HPV vaccination if you haven't had an HPV vaccine, and if you're a smoker moving towards quitting smoking. Those are the three main things that we have control of and can modify.
Wow, okay. And can you tell me, technology, it's always evolving as, time goes on. Can you tell me, how has technology been used to detect cervical cancer, and what are some unique techniques that OSF uses to treat it?
Yeah, so we're always aimed at prevention, and the good thing is that our testing has gotten better and better. So a lot of women are confused now. They only need to come every 3 or every 5 years, and that's because the testing is much better. So we have great sensitive testing. There's also a recent recommendation that some people are eligible to even get screening without a pelvic exam. So if you haven't been getting screening because you were afraid to get a pelvic exam, talk to your provider. There may be an option for you. For those who, unfortunately, we miss with screening and do have a cervical cancer diagnosis, we have excellent new technology over at OSF. We've got excellent radiation oncology, some tools not used anywhere else in the area. We've got great surgeons. We even have clinical trials for the latest and greatest in drugs for treating this cancer.
Wow, okay, that's very interesting. Well, thank you so much for coming on to 25 News and joining us today to inform us about this very important cause. And we'll share all of these details on our website.